sentuhan mata belum tiba. Tapi jalan kebenaran tak akan selamanya sunyi. Ada ujian yang datang melanda, ada perangkap menunggu mangsa. Ada ujian yang datang melanda, ada perangkap menunggu mangsa. Sekeping hati dibawa berlari jauh melalui jalanan sepi. Jalan kebenaran indah terbentang di depan matamu para pejuang. Sekeping hati dibawa berlari jauh melalui jalanan sepi. Jalan kebenaran indah terbentang di depan matamu para pejuang. Tapi jalan kebenaran tak akan selamanya sunyi. Ada ujian yang datang melanda, ada perangkap menunggu mangsa. Sekeping hati dibawa berlari jauh melalui jalanan sepi. Jalan kebenaran indah terbentang di depan matamu para pejuang. Akan kuatkah kaki yang melangkah bila disapa budi yang menanti? Akankah buka kata yang merata pada debu yang pastikan hingga? Mengharap senang dalam berjuang, bagai merindu rembulan di tengah siang. Jalannya tak seindah sentuhan mata, pangkalnya jauh, ujungnya belum tiba. Tapi jalan kebenaran tak akan selamanya sunyi. Ada ujian yang datang melanda, ada perangkap menunggu mangsa. Ada ujian yang datang melanda, ada nyata, pangkalnya jauh, ujungnya belum tiba. Tapi jalan kebenaran tak akan selamanya sunyi. Ada ujian yang datang melanda, ada perangkap menunggu mangsa. Ada ujian yang datang melanda, ada perangkap menunggu mangsa.
Assalamualaikum everyone. We'll be starting in about 4 minutes, inshallah. Welcome everyone who's been here. And Dr. Rubina Hamid is here too. Assalamualaikum warahmatullahi wabarakatuh, Rubina.
Walaikum assalam. Walaikum assalam.
Alhamdulillah, so good to hear your voice.
Yes, it's nice to see your faces.
That's right. Alhamdulillah, inshallah we'll meet in person soon. But it's good to see you virtually.
You guys haven't met in person, or is it just?
Yeah, no.
Really?
That's the beauty and the blessing of this pandemic, I suppose. We got connected.
No, we haven't met at all. So I don't know. I don't know you guys. Yeah.
Alhamdulillah. I haven't met you in person, but we feel so connected, Dr. Rubina. Alhamdulillah. I feel like I've met you for years.
It's been, yes, that's like you said, it's one of those things about the pandemic has brought people from very different backgrounds and different, just brought people together. And that's been a blessing. That's been a blessing we've been. You think that we should take the positive out of it. So you guys are all ready to roll?
Inshallah, in a few minutes, I suppose.
Yeah.
We'll start at sort of 2 o'clock on the dot. And
So,
this is Zaki, by the way.
Okay, assalamu alaikum.
Walaikum assalam.
Yeah. What are you in? What do you do?
So inshallah for today, I'll be the co-panelist with Dr. Erika. But I guess in terms of what I do in terms of uni, I'm a Bachelor of Science student. So inshallah pre-med.
Yeah.
Inshallah, pre-med.
Alhamdulillah. At Melbourne.
At Melbourne, yes.
Melbourne.
Alhamdulillah.
Inshallah. Thank you for you.
Thank you. But how is it like being a pediatrician? Is it
I think it's one of the best things.
Oh yeah.
Yeah.
How so?
I don't know. It's just one of the things that you being when I was your age or younger, I wanted to be a doctor, and so once I did my training, PEDS was one of the things. I think the best thing about PEDS is that you just get your the kids, once they're better, they're just better. They just go. There's no the adults just I can't treat adults. They never get better. So,
that's right.
With kids
are very honest, very honest.
It's just I don't
very
know how
pure.
Yeah, how GPs and other people do, I'm not sure. I think it's so complicated. It's very rewarding to work with the children, very rewarding. Even so, I did a lot of work with children with cancer.
Oh, okay.
And
is it during your residency that you made the choice?
Yes, that's right. I mean, I think when I worked with I trained in UK, so I worked with children with cancer, and it's just beautiful. And I think even they are so so happy. They just get their chemo and they smile at you, and they just want the sticker or something. It's just not like what's going to happen to me in 5 years. They're not worried about it. They just what's happening today is what's important.
That's true. That's true. They're very present, I guess.
Yeah,
what about like the hard to deal with children? Like if you have to like stick a needle in them, and then.
So when I was a resident and registrar, and I'd still I think I'm one of those I think you have to have, it's like a door prize. I used to love putting needles and lumbar punctures and things in kids. I'm one of
Punctures
the
in kids?
favorites for
Oh
the
my
kids.
God.
The kids would
I'll
love
pass
it.
that on to you, Dr. Rubina. I'll pass that on to you.
Oh, the kids love.
It's not mine.
They used to come, and I had to be there to put the kids. So I was one of those. I think it's because they knew that they need to have it, and that's it. And you just and then they don't have. You put it in, and then obviously you have to have the skill to do that. But it's again, it's very rewarding because they need you don't put needles in kids unless it's really needed. And I think, and that's the thing, that when if you don't do unnecessary tests, unnecessary investigations, the kids kids really forgive you. They don't, because they know that's for their best.
So I'm kind of curious because I did see on social media, kind of like there was this doctor, he had to like put on a performance with like lights on his fingers or something in order to distract the baby. So he had to like inject them, and I was like, oh, maybe you did something like that, maybe put on a
So we
performance.
had in emergency department, we have clowns and other people working for us, because if they're really really scared of a procedure, then you do have doctors in clown, not doctors themselves, but the actual people working as clowns for us to help. So the play therapy works quite a bit. Yeah, we
And there are bubbles as well. I remember blowing bubbles for the doctors, for the registrars.
Yeah, that's right. So blowing bubbles, and there's just using distraction techniques. Yeah. So hopefully, no, I think you can ask me about pediatrics any day, and I will be just like so excited about talking about it.
We'll hear more from you, inshallah, soon. Alhamdulillah, it's 2 o'clock, 3 minutes past 2 o'clock. Shall we start, Zaki?
Was the lighting better before, or
we've got
is
quite
it
a few people here already too, alhamdulillah, and the director of Madaniya Foundation, Rian Nugraha, we call him Rian, is here too.
Assalamualaikum, Dr. Rubina, Dr.
Walaikum
Erika, Zaki.
assalam.
How are you all?
I'm good, alhamdulillah. I'm good. I've not had much to do with Indonesian community. Well, just on individuals, I've met people, but not so many. So I'm feeling a bit nervous among people who all of the same sort of background.
But we are very fortunate.
You just have to be a bit kind to me.
Thank you very
We
much.
don't bite. Don't worry, Dr. Rubina. We don't bite.
Especially online. No bite. Okay,
All right.
please.
All right, so I think we'll start, everyone. Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Nahmaduhu wa nasta'inuhu wa nastaghfiruh. Wa na'udhu billahi min shururin anfusina wa min sayyiatina a'malina. Man yahdillahi fala mudilla lah wa man yudlil fala hadiya lah. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Amma ba'd. Rabbi shrah li sadri wa yassir li amri wa hlul 'uqdatam min lisani yafqahu qawli. Hello everyone. Good afternoon. Selamat siang semua. My name is Dr. Erika.
And I'm Zaki. And joining us is the special guest, Dr. Rubina. She's a specialist pediatrician from the UK. And from those who are new to this event, we want to welcome you guys to this COVID-19 series. It's called COVID-19 in Children, Preparing Family for the Re-Entry. And it's part of a podcast series organized by Madaniya Foundation. And just a little background about Madaniya Foundation for those who are new. So we were founded in 2010, and Madaniya is a non-for-profit organization in Melbourne that focuses on Quran, youth, and family. Madaniya organizes regular Quran classes, youth activities, and family empowerment program. Please support our program and donate to Madaniya account number. So if our operator can quickly show the image. Fantastic. Yep. So just over there, inshallah, over there, just information in regards on how you can support Madania Foundation in their efforts to help empower the Indonesian community. And also, we would appreciate later on if you could fill a short survey on how the COVID-19 pandemic has affected you and the family. The link for the survey will be provided in the chat box by one of our ninjas, inshallah.
Inshallah. So the rundown of today's event is as follows. The first, to begin, we'll have a video showcasing perspective from our fellow members of Indonesian community regarding the impact of COVID, lockdown, and our recently gained freedom. And following that, we will finally have a more discussion with Dr. Rubina Hamid. We'll get to know who she is, what is she doing, why she is here today, and comments or discussions, where we'll answer some questions from the community about COVID-19 in children, how is it affecting us, and with the re-entry program, what to look out for. You can give your questions and comments in the link that will be provided. It will be through Slido. You can find it on the chat box. In addition, there will be door prize for the best questions and the best comment. So make sure you put your best comment and your questions there. And to cater for our native speaker in the audience, native Indonesian speaker, we'll also highlight some important points in Bahasa Indonesia during discussions. Dalam kesehariannya, Dr. Rubina familiar dengan bilingual. Semoga semua informasi dapat sampai dengan akurat. So it will be bilingual this time.
Awesome. And then in between the topics, we'll have a short performance by one of our beloved children of the community. Very excited to see that. And last but not least, we will have games before the closing ceremony. And inshallah, these games will also be accompanied with even more prizes. So please be sure to stick around to collect your prizes, not only for the games, but also for the comments and the questions that we'll be having. But inshallah, before we commence on our first agenda, we would like to thank today's sponsor, Human Initiative, and we want to share a few short words from them. So if the operator can please play the video.
Human Initiative Australia has been established since
I believe the sound.
Human Initiative Australia has been established since 2017. We are a humanitarian aid and zakat management institution. We have 3 core programs to help people in need. Number 1, Children Program. This program is aimed at increasing the knowledge and skills of children from disadvantaged backgrounds through the provision of education, training, scholarship, and learning needs. Number 2, Emergency Response Program. We provide an essential and urgent need to help people cope in emergency situations, such as delivering flood aid for flood victims or bedding kit for an earthquake victims. We also have an education assistant specially for international students, medical assistant. We provide assistance for the medical expenses, and also food hamper program to help with the grocery need. Number 3, Empowerment Program. This program aims to improve overall quality of life and achieve sustainable prosperity for our beneficiaries. Dear friends, all of these programs will not be successful without you. Please support us to put a smile for them.
The volume was a bit small, wasn't it?
Yes, unfortunate, isn't it? But alhamdulillah, thank you, Human Initiative, for sponsoring our event. Such a beautiful cause. So please support Human Initiative so we can support other people as well. Now let's get back to our event. So guys, Thursday, 21st of October, 11:59 p.m. marked the reopening of Melbourne's 6th lockdown. And as vaccination rate increases, more freedom was granted from the 29th of October. School children have now back to full-time on-site learning. No more travel limit. Indoor and outdoor gathering are allowed. People are moving more, but cases are still high. There are almost 17,000 cases today in Victoria right now when I checked last night. How do you feel about it, Zahi? Are you excited? Are you nervous? Somewhere in between?
Well, I mean, 17,000 active cases doesn't look too good, but inshallah, I think if we're proactive in terms of our vaccination and, keeping some, I guess, standards for social distancing, we'll be able to, combat the coronavirus and its effects on the family. But Allah alam, everything is takdir. We
Yes,
pray at the
inshallah.
end of the day. We make ijtihad, we do our best. And at the end of the day, it's Allah that will really protect you. But I think the committee has made a very nice video showcasing, I guess, the general perspective.
Yes,
on-
let's hear and see what they say.
Let's go. Operator, please show the video. Oh, the sound's good. Awesome.
Yay.
I'm happy because I can meet all my friends again and interact with everyone again face to face.
Lockdown has ended.
I feel relieved and a bit anxious.
Okay.
I feel very happy and excited that lockdown has ended, and I think it's because all the staying at home and social isolation has been really mentally exhausting.
I guess I feel really grateful that the lockdown is finally over. Alhamdulillah.
So relieved. I feel so happy because we've been spending way too much time inside the house, and now that we have the chance to go out again, it feels so wonderful. And
catch up with all my friends and see everyone again since it's been a very long time since I've seen them.
Do you feel? I guess go back to school, meet my teachers and friends again.
The thing I want to do most is to go travel and explore new places with my friends and family.
the first thing that I like to do after the lockdown is taking my kids to go out. I'd like to be able to travel again, and my kids have been missing out a lot during the lockdown, so I feel bad about them, so I'd like to.
I feel more excited because I can see everyone again.
Okay. More excited, but a bit anxious.
I definitely feel more excited than anxious, and I think it's because that I trust that we've all been doing the best we can to protect ourselves and the community.
I actually feel a little bit excited with this. It puts less pressure for stay-at-home moms. Gives them a bit of time to relax, I guess. At the same time, I'm happy for the children to be back at school because then they get to play with their friends.
I'm in the middle. I'm not too anxious this time because vaccination rate in Victoria is really good. So I think I have the reason not to be paranoid anymore this time.
We should wear a mask and sanitize our hands and also keep distance from people.
Okay. Wear face masks, sanitize, social distance ourselves, and get vaccinated.
Having good hygiene practices and still wearing masks in certain situations can definitely help reduce the risk of catching the virus, but also making sure that you're vaccinated to minimize its harm.
as a parent, I need to stay calm. Don't let my emotion cloud my judgment, number one. I guess the main thing also is to always, I guess, to get the kids tested and follow the health advice of the HHVIC and as well as your GP.
SubhanAllah, that was the same reaction when the gyms were open, not necessarily the first lockdown. So,
Yay!
Alhamdulillah. What's I guess do you also relate to that video, Dr. Erka? Because I know you actually had recently, is it your fourth or your third?
Yes, I've got 4 children of varying
God.
ages, alhamdulillah. And we have these mixed emotions in the house, being free to see them, see their friends again, and thinking if there's any more cases and we have to isolate, how do I let them know they can't go out for the next 2 weeks?
Are you excited now that I guess maybe they're not going to be at home like all the time, and then you get to send them to school, maybe get some alone time? Or
mixed feelings, Aki. Sometimes I miss them too much.
Yeah?
Yeah, Michelle, your parents probably feel the same too.
Oh, maybe
All
I've been
right.
staying home way too long.
way too long at home. Well, let's welcome Dr. Rubina again. Alhamdulillah, Dr. Rubina is here, everyone. For those of you who just joined us, Alhamdulillah, we are very, very grateful and very honored to have Dr. Rubina Hamid here. She is a pediatrician. She was trained in pediatrics in UK. She has worked with children from birth to 18 years in several countries, including Pakistan, Saudi Arabia, UK, and now for the last 18 years, she's been based in Melbourne. She loves working with children. Her special interest is in developmental pediatrics and allergies in children. She believes in preventive medicines and very passionate about providing support and advice through all important growing years. Welcome to Rubina.
Assalamu alaikum. For inviting.
For my exams.
Hope is the video and the sound okay?
Yes,
can you hear me?
very clear.
Yeah. Okay, alhamdulillah. So Jazakumullah, I was just looking at your foundation and the video that you just showed. It was amazing. I think you've already said all the things that I need to say, so I think that's all done.
All done.
Oh, we'd love to hear
Mashallah.
your voice and your
Mashallah.
expertise.
Mashallah, as a community, I think you're doing a lot, and may Allah bless this community and put more barakah. And with our time here, I want to thank all the parents and participants who had joined us. You may find something useful today, but if you don't, then this would be it's like a knowledge that we all need to know and pass it on to somebody else as well, in terms of and this deed be accepted by Allah subhanahu wa ta'ala for us. It's just and may angels be recording this as a deed for us for our akhirah, really. So alhamdulillah, jazakallah. So we'll it's a pleasure for me to be here with you guys today.
Alhamdulillah, jazakallah khair, Dr. Rubina. Now, tell us more about yourself, Dr. Rubina. We're having a chat, and the audience here, probably not everyone knows exactly what pediatrician is. Can you tell us more about what you do on a day-to-day basis?
Okay, so pediatrician basically is, I call myself that I'm a baby doctor, but obviously babies, I mean that anybody who's, I attend deliveries for ladies whose babies may need some support from a doctor who is expert in looking after babies who might get into trouble. So babies born through cesarean section, or babies who've had borns with other instruments, or little premature babies, pediatricians tend to attend those deliveries. So that's from birth, if any problems happen, and then ongoing issues with children's health, whether it's preventive or whether it's curative. That's what I do. So like you said, I've got special interest in allergies, but I also see a lot of children with behavior issues, with mental health issues. And I have always also worked in hospital, have trained in children who have had cancer. So I think it's everything to do with the child. That's what a pediatrician do.
Yes, just doctors, but for children, basically, isn't it?
It's just for children, yes. So don't ask me any questions if you've left school.
Oh, no.
So Zaki, no more for you. You've gone to university, unfortunately.
I wanted to ask, what can I do about hay fever, So.
No, but what you can do is, you just can have children of your own and then bring them to me.
I mean,
that would be your
one
goal,
day.
Zaki, inshallah. Now, you sound very passionate about your work, Dr. Rubina. It sounds like you found your niche, the thing that you really like in the medicine. Can you tell me about the background? Why did you choose pediatricians as a specialty? We discussed it a little bit before, but now we have more people here. I think they would like to hear too.
I think when we do train in medicine, after that we do rotation in all the in medicine and surgery, and then we do rotation in other wards. And I think that's where people choose what they want to do and what excites them the most. I think that's what I would say. So when I was training, I think just working with children, how they respond to you is what I like. They, when they're ill, they really want to get better. They don't, and when they get better. They just have a smile and they go, and I think that's what I like about working with children. It's very rewarding. Obviously, there are lots of times when they have terminal illnesses, things which are not very, and we have to talk to the parents. So working in pediatrics, you're really working with the family and with the child. And child is usually not worried about what's happening. A lot of time is the parents, as we all are parents here. A lot of us parents here would know that a parent is. So you need to reassure the parent. And I like that sort of part of pediatrics. And also there's a lot of preventive things that we can do. So in other parts, in the disciplines. For instance, in things happen and then you go in and do things. Within in pediatrics, you have a chance to do it before it gets worse.
Yeah.
You can talk to parents and I think and talk to the child. So it's just rewarding. It's very rewarding, and that's what I found. And it's very and it's I like playing with kids. I think. And most of the time I say to my patients is that you've come here to play with. I'm not your teacher. I'm not a policewoman. I'm just here to play with you. And if there's anything wrong, we can maybe make it better for you.
That's lovely. That's lovely. And Dr. Rubina, I hear that outside your work, you also do a lot of community education, just like today. So this is not your first. SubhanAllah, tell me more about those.
Some and not a lot. I do just talking to parents and talking at schools, and if there's I think it's just more of talking to parents. I think is so that's the community work. I think mostly we need to perhaps through friends. So it's I don't think there's a lot that I do. You guys do more than I do, definitely.
SubhanAllah, you're too humble about yourself. I believe you impact the communities a lot more than you're saying. Inshallah, we want to thank you again for, I guess, sparing the time and sparing the efforts, I guess, help elevate us in terms of our education, in terms of, I guess, helping us keep our children safe, and, just equipping the general community in order to like face the, I guess, the outside world, especially now that we're starting to open up and everything like that. So inshallah, I just wanted to, I guess, rephrase and maybe explain how the Slido works. So inshallah, if you guys click on the link, or if the link isn't working, if you search up Slido on your browser, either go to www.slido.com, and then you enter the code number 921029 when the site pops up. Inshallah, you'll be directed to our Q&A browser section, and also our comment section. So when you do leave a comment and it is voted as one of the best comments, as said before by Dr. Erica, you will be receiving a door prize. So hopefully make sure that the comments are very meaningful and very well said. Inshallah, I just wanted to quickly explain the structure of the discussion phase. So inshallah, there will be two primary discussion phases where inshallah the questions from the community, either submitted directly through us or maybe a very popular one through Slido, will be asked directly to Dr. Rubina. And inshallah, with all her expertise, Dr. Rubina will be able to solve a problem that you have, and maybe answer some critical questions that you've been having at the back of your mind. So inshallah, the first portion will be more towards the medical field. And inshallah, if you do have any questions, because in regards to maybe the social aspect or maybe the mental health aspect, because if I'm not mistaken, that's actually quite a big, I guess, worry that many parents, and especially kids my age and maybe even younger, have about themselves, especially how COVID has affected their self-esteem and self-perception. Inshallah, we will save those questions for the second part of the discussion phase. So, Dr. Reka, do you want to start off with the first question?
Yeah, sure. Now, Dr. Rubina, maybe we could start with discussing how is COVID-19 affecting children. We hear a lot about this latest Delta variant, being quite severe and nasty to the adult population. Is it the same case in children? Should we worry, or should we feel actually relieved?
Okay, so I think the Delta variant is the one important thing that we may perhaps we start off with is that, how many cases, for instance, we've seen here in Australia since we started seeing, since the first case was firstly identified in Australia. So to date, in kids under 19 years of age, we had about 50,000. So I think 50,000 is a big number of under 19 to be affected with SARS-2 COVID infection. But it is, Delta variant is more easily transmitted. So that's where we're seeing that the number is high. And so because the number is high, people get very worried about it. That, this is such a big number that we are seeing in kids. And I think it is important also to remember that in the next 8 weeks, this is going to jump up a lot because we are opened up, and we are going to see a significant, and I think about 8 times, it's projected about 8 times this number. We are going to see a lot more cases in children.
Right.
And we, I think our mentally last year we were really worried about this and a lot of social isolation, a lot of quarantine and all those things. And, we're protecting our kids. Last year was a slightly different to this year because it's just so easily transmitted that we are not able to. So from zero, what we wanted to achieve, 0 case in Australia, we obviously gone. Now we can't do it because it's not possible with this virus to achieve that. So your question about, is it more nasty? It is, we are very fortunate, and we think we can only say that to Allah subhanahu wa ta'ala's blessing to us that, it is more transmissible, but it is not more nasty in kids. No. So I think that's a relief for all of us. So as a comparison, what we can say is that in Australia so far, unfortunately, we'd had 2 deaths in children under 19. So 2 deaths under 19 in this whole with COVID, and both kids had a pre-existing severe disease, some other illness because of that. And under 10, we have not had any deaths. So I think that's a big relief for parents who are listening, when they're looking at the numbers and they're really scared that what's going to happen to my child. And I think to be fair, we are learning as we're going, but I think we have a lot of data now from overseas. We have a lot of data from other countries to know that this is a true data, and we don't have to be too worried about COVID-19, but I think we probably might go through all the things that when do we need to be worried about?
Yeah, so if I get it correctly, you may still get the infections, but it's not as bad as if adult were to have it, and certainly less death in younger children.
That's right. I mean, I think it's a comparison, like I'm saying, the 50,000 cases so far, and we'd had 2 deaths, one last year and one this year. So I think you say that obviously it's in comparison the risk is very low for a severe infection with COVID and death.
That's true. I would just like to summarize this for the Indonesian community speaker here. Ibu-ibu, bapak-bapak, COVID-19 untuk anak-anak ternyata tidak separah kasus pada orang dewasa. Jadi walaupun masih transmissible, masih bisa terkena oleh COVID-19 infections, tapi tidak separah dengan orang dewasa. Jadi ini suatu hal yang mulai menenangkan ya buat orang dewasa di sini. Okay, thank you, Dr. Rubina.
Sorry, I just wanted to quickly follow up on that. Why do you think that is the case, that I guess adults are being affected worse than children? Is it because I guess when you're a child, you're more transparent about your I guess your symptoms, and if you're sick, you just want to get treated. But sometimes adults, most of the time, I do see online they're in quite denial about their symptoms and everything, and they say, oh no, it's just a flu, it's just like a flu. But then
it's just hay fever,
or hay fever, something like that. But then after like a few days, they realize, oh, it's not actually, it's actually much more worse, and by that time it might be late. Is it something like that, or is it maybe the difference in biology of children?
So I think that the full cause we don't know, but we do believe that I think the reason why it's not as severe is because the children's immune system is different. The children are not just small adults. Their immune system is very different to how they fight viruses and things like that. And as we all know, the children are being exposed to viruses a lot more than adults do, because they are in a situation in schools and childcare where everybody's got a snotty nose. So they are exposed to these viruses more. And I think that the way they deal with it, their immune system is very different. That's one reason that we think that's why they are able to cope with it. The second reason, again, I think there are lots of studies still going on and we don't have all the answers, but the second thing is that when this virus, the COVID virus, hits an adult who has other issues, the way there is a what we call is a toxic storm or something, which means that they releases lots of toxic things in the body, which causes all the blood vessels to dilate and all those. And it's the way how your arteries are already, how your blood system is already, and you know, as we get older and older, those systems are not as pure and as simple as it's in kids. So the kids don't seem to get those, that's why they're protected by it, and while the older people are less protected. And I think that's one of the other explanation which has been given, that that's why they don't manifest severe disease.
Yeah, mashallah. It's really by the blessings of Allah, isn't it?
And it is,
children.
yeah, that's right. And I think they have a lot of other things to deal with in life, but there's still to get, I think Allah's protected them. So we'll just have to thank Allah for it.
Yeah. Now, obviously, no one would want their children to get infected with any illness, especially COVID-19. But as you mentioned before, it is more transmissible, so undeniable and inevitable. Children will get the infection at some stage through this lockdown easing. Now, what can parents do in case they happen to get the infections?
Right.
What can parents do to help them?
I think it's like, I think we will probably we'll probably be saying this again and again, that this, and I think now almost our language is changing, the way we're talking to parents and we're talking to adults, is that a lot of people are going to get COVID, even children who are, even adults who are vaccinated, because of the nature of this virus is that you will still, so that, and children, when a child will get a thing, well, first thing to remember is, like one of the video person, a person in the video said, don't panic. And, you know, this is, don't blame the child. I think that's one of the things that I would really want to say to parents is, don't blame the child for saying that, you know, you have brought the virus home. It could be a, you know, your 14-year-old bringing the child home, or a 12-year-old or a 10-year-old. But it would be, if a child becomes positive, then it is important not to blame that who has brought the virus home. What I think your question was, what to do, is that right?
Yes,
how to manage,
how to look after them.
Yeah, I think that the like we said before, that most children have it very may not have any symptoms. So it is important to remember they may not have any symptoms, and then, or they might have very mild symptoms. And the symptoms could be very similar to a hay fever, like Zaki was saying, that, you know, he gets hay fever, very similar to just a runny nose or a sore throat or a blocked nose. They might be sneezing a lot, and may have a fever and a cough. Quite a few kids complain of headache, and sometimes a muscle ache and fatigue. The older children would complain of that.
Right.
Diarrhea and vomiting can be present, but not as common. Loss of smell, loss of taste in adults, more common than in children. But yeah, those are sort of symptoms that they need to be looking out for. And if they are presenting, it's do you want to translate that first, and then I could talk about?
Yes, I can do that. I was about to say, it's a very important point. Jangan panik. Bukan salah siapa-siapa, ya. Bukan salah siapa-siapa. Jangan salahkan anak. Bukan salah siapapun anak kita mendapatkan penyakit COVID-19, dan gejalanya ternyata kebanyakan ringan, bahkan tidak bergejala, atau mirip batuk pilek biasa. tambahannya mungkin kadang-kadang ada diare, ada muntah, dan untuk anak yang lebih besar, kadang-kadang ada headache juga, sakit kepala ya. Silakan. Oh yes, thank you Dr. Rubina. You can continue.
Yeah. So how to look after them? I think the first thing is to make sure that you've confirmed it. So confirming is quite important. So to getting a PCR test done. So I think child might have a cough and a fever for some other reason. So it's not just assuming that it is all due to COVID. It's good to it's always good to confirm it. And then the treatment is usually very simple, the same, just fluids and analgesia and paracetamol or something if they do have a fever, if they do have a cough, and that's about the treatment that we would be recommending for children, not more than that. If things are more severe, like the cough not going away, high temperature, and you're worried, then you should be asking a consult from a GP or taking the child to the emergency department.
Emergency. Yes, thank you very much. So
do you want to
konfirmasi,
translate that? Or
yeah, I think that's a bit obvious. Just konfirmasi bahwa ini adalah penyakit dari COVID dengan swab testing, dan penanganannya sama seperti batuk pilek biasa ya ibu-ibu bapak-bapak. Jadi insya Allah bapak-bapak ibu sini udah familiar dengan bapil, common cold. Tapi kalau ada kekhawatiran, please bawa ke dokter, GP atau emergency. Alright, you can continue, Zaki.
Oh, fantastic. Yeah, so I guess to follow up that question, I guess the next logical step would be like, the management and I guess like the prevention, how we would think. But just right before that, there was actually a quite, I guess, interesting question that I was confronted yesterday, is that are kids also at risk of, I guess, also showing like have like possibilities of having long COVID symptoms, like how sometimes I guess adults, even though like their COVID went away, however their breathing are still impacted, and I hear the CDC said like maybe up to even 6 months or even longer. Are children's could they be at risk?
Okay, yeah, I think there's been a bit of mention of this long COVID, and some few months back, I think there was a study from Israel, which was, I think, published in one of the sort of main, one of the newspapers, and people got very scared of that. I think long COVID, first of all, I think it took a while for people to define what long COVID is. And this is it is seen in adults, and it is basically if you have a confirmed COVID or a suspected COVID symptoms, and you have the symptoms 3 months after the onset of that, and the symptoms lasting for 2 months. Okay, so it's it's quite a long period, and we had been, like we said, we have been very fortunate in Australia that we've not seen. And last year we had lots of cases of COVID in children, and this year we in Australia the study was done. We have had no case of long COVID in Australia that we can report, that the cases have lasted. And I think that going back again to my why do I do pediatrics? Again, I think when children get better, they just get better, and they don't go on about it. So I think there is an element of long COVID, but at the moment we're not seeing in children long COVID.
Okay, so you're saying it may be due to the interaction between COVID and I guess pre-existing medical conditions, and maybe COVID worsening them, and that being attributed to long COVID effects.
Yes, I think this is where it's very difficult to really separate all those things in adults, especially when they have other pre-existing conditions may have already had pre-existing conditions. And so I think that it is there, and other people do have loss of smell and loss of taste and a few other things, fatigue from going on. But in children, we've not seen it. From last year, we'd had cases that had persisted because specifically in kids who had the COVID, persisting 3 months after due to that. Like I said, worldwide, it has been published in children. Again, those I think it's not really incidence not that high. So again, alhamdulillah, that we're not seeing.
Alhamdulillah, we also have quite a few questions coming up in Slido, Dr. Rubina. I might just read and combine 2 questions about vaccine. So, which type of vaccine is better and less harm to children, especially drawing the attention to Pfizer, which has got the approval for emergency use for kids 5 to 11 years old.
Okay.
What do you suggest? And also considering symptoms in children are much milder, do they really need to get vaccinated? So I think there are 2 questions. One, which one is better? Which vaccine is better? And once you've done with that answer, then, you know, if you decide to vaccinate, do you really need to vaccinate? I think that's the questions. Thank you.
So I think just what Zaki said initially, and you know, in your videos, you have really tried to get that message across, is that the best protection for children is the adults around, both at school and in the home environment, or everyone to be fully vaccinated, double vax, but also now that we are on to the booster dose or the 3rd dose, then people who are coming up to it, and when it's available, go and get that done. I think that's the main thing about the vaccination that is important. Now, from 12 up, yes, it's approved in Australia, the vaccine. For 5 to 11 last week, or just very recently in the US, only the Pfizer vaccine has been approved. So it's the only vaccine which has been approved. So there is no, I think that will be the vaccine which will be approved when it comes to Australia. So that's, I don't think I need to sort of talk about other vaccines, because the others, they are seeking the seeking approval. Pfizer and Moderna are based on the same sort of way that they are made.
The mRNA?
mRNA, yeah. And they say, so they are the mRNA vaccine that saying they're going to be, and it's likely the Moderna will probably also will get a license to be used. But at the moment, it's only Pfizer. So their choice is limited, and I think sometimes not to have a choice.
I'd like to highlight the point, Dr. Rubina, about the protection, the best protection is by vaccinating the adult. Bapak-bapak, ibu-ibu, vaksinasi buat anak-anak memang masih dalam studi saat ini, tapi yang paling penting saat ini adalah vaksinasi orang dewasa. Karena kalau orang dewasa yang terkena COVID, maka anak-anak juga akan terpapar. Jadi proteksi yang paling baik adalah dengan memvaksinasi orang dewasanya itu sendiri, gitu ya. Kita kembali lagi ke pertanyaan selanjutnya. Okay, Zaki, maybe we can continue to the next question here about the mask.
I think the next question that you had was about is it necessary for the kids to have the vaccine? Should we give them the vaccine or not? So the new vaccine, which is it's not a new vaccine, but the vaccine is the same. The dose is half of what the adult dose would be for the 5 to 11. So it's in a different vial, so it will be different. So for people not to make the mistake, I think it's dispensed in different way with a smaller needle. So it's going to be, that's sort of important for kids to know that it's not sort of big needle, the ones that we're using for adults and other older children. Is it necessary for kids to have it? I think the kids are, there is a debate about it, whether we need to give the children the children are, I think the debate is it important for them to be back at school and to have an uninterrupted learning? Because if they're going to be positive and they're not vaccinated, this is all going to be, another year of interruptions and things like that, only because of lockdowns might not happen, but to have the quarantines and things like that if you're not vaccinated. I think this is where it be coming out to be how that's the risk and the benefit. Yes, I hear and I totally agree with that it is mild in kids. But I think sometimes it is also important to remember that there are children who are not, who have, for instance, children who have cancer or children who have other issues. So you're protecting your friend who might be sitting next to you, who may be able to, who can get the vaccine, but not be able to produce the protection. So that's how children's vaccines work. In general, that is the principle, that the children are, a lot of children are vaccinated to protect themselves, but also to protect the community.
Yes, very important point, isn't it? Vaccination is not about yourself, but also about other people.
Yes, that's right. So I think the risk, the benefits, I can hear that, they're mild disease, you don't need it. But I think you are, through vaccinating your kids, they would be protected. They would be able to get the education uninterrupted, and they would be protecting others in the community, and not only themselves, but maybe their grandparents whose immunity might go down very quickly. So it's not just a friend. So I think this is where we are obviously wanting everyone to be vaccinated.
It's interesting how you point out that the effects of COVID infection is not just the infection itself, but also on your learning, on your social, on your being able to stay at school rather than isolating at home for another 2 weeks whilst getting through the infection itself. I would like to highlight that, Bapak-bapak, Ibu-ibu, vaksinasi untuk anak-anak ini bukan hanya permasalahan apakah mereka akan terinfeksi dengan parah atau ringan, tapi juga efek dari penyakit itu sendiri dalam kehidupan sosialnya, mental health-nya, dan juga edukasi anak-anak supaya mereka tetap bisa belajar face-to-face di luar. Alright, we might move on to the next question.
Yeah, we actually have quite a lot of questions, so I might be joining on some of the questions that maybe in the same relevant topic. I think one of them is I guess the mask usage for children, and I think I've been kind of curious about that myself for quite a while. Also, is that why are children kind of like exempt from wearing masks themselves, and should they be wearing a mask? And I think aside from like using a mask, are there like on top of that, are there like non-medical, I guess, like ways that we could be combating the COVID? So like something you could be doing at home, or like maybe aside from using the standard hand sanitizer, mask and vaccine, I guess.
Yeah, I think alhamdulillah, we as Muslims, I think we are very fortunate because we do wash our hands quite frequently. We have to wash our hands all the time for wudu and before we eat and things like that. So a lot of, I think personal hygiene type things are being practiced in our ummah without this COVID and pandemic and everything. But in terms of what your question is, somebody asking that why do they have to, why they're not wearing it? Children,
why are kids exempt from wearing masks?
I think the kids are not exempt from wearing it because, as we know, that the kids are still need to wear masks in settings where they're indoors from year 3 onwards. So year 3 is how old? It would be an 8-year-old, 7 to 8-year-old. So it's quite young age for from that age to wear on from that age. So they're not exempted to wear. They have to wear it in school. They have to wear it properly in school, and they have to practice their social distancing. So I think, and the masks are quite important because that masks do prevent a lot of transmission from, you almost like double mask if two people are wearing it. It is both people are wearing masks, then it's so it reduces the transmission quite considerably. So I don't think they're exempted from wearing, and they have to wear it in public transport. Very young children, we don't want them to wear, because obviously there's always a risk of them getting tangled and getting all those other things that might happen. And little children don't want them to be playing around with each other with tying masks around their necks and things like that. And I think there's other risks of using, and it's exempted on children who have may not have the mental ability to look after the mask and wearing it properly. That's the exemption there. But I don't think otherwise we have an exemption at this stage for schools and indoor settings where you can't maintain a social distance.
Well, I think that's a very important point that you pointed out, as in like children who are, a bit too young, don't recognize, I guess, the dangers of something as simple as a mask. And I guess that's also why a lot of like products, even though they're quite harmless, but there's always that caution, like, keep away from children under a certain age, because I guess it could end up being either like a choking hazard or something like that.
Yeah, and I think that's right. And I think that, you are hoping that, the younger kids are able to, they just they have their other methods, like you said, sanitizing their hands, using the social distance other ways. But it's hard. I mean, I think it's hard for very young babies and other people. We would not ever recommend for them to wear masks.
Wonderful, fantastic. Would you like to translate that? I feel like that's a super important point.
Yeah, so basically, if I can summarize this and make sure I've got it right, Dr. Rubina. So mask is still important. If your children can wear it, please do. But for younger children, like very, very young, 3 or 5 years old, even babies, mask can actually cause potential harm from tangling and suffocating and sort of choking as well. Is that right?
Yes, that's right. I mean, I think you just need to make sure that we're not just putting a mask on a baby, for instance. There's no reason a baby should be wearing a mask. I think the adults around them has to be to be. If you have a cold, you don't go near your baby and you don't kiss your baby because you don't want to pass it to your baby. Or you wear the mask to do the things that you don't want to do around your baby. You don't want the baby to wear the masks.
Yeah. So other measures to look after and to prevent the infections.
Yeah. So like
I might just translate that.
I was just gonna add, like, masks are primarily to prevent you from spreading, not the other way around, right? Like, does it really prevent you from getting it? Like,
yes, it does prevent you from getting it as well. So I think that's what it is. That's why the social distancing is also important. But yes, it does prevent, because if the other person is positive, the risk, I think that I can't give you the exact, but I think there's quite a nice slide about it as well, that how it reduces if you both are double masked. It means that you are masked and the person who has the virus is masked, then it prevents more than. But I think we are very fortunate now that we are majority of 84% of our population in Victoria are double vaxxed. So I think, and we can come back to it in a minute about if you're double vaxxed and if you get COVID, what is your risk of passing and things.
Yes, okay. I might just translate it for the moment. Masker tetap penting, sangat penting. Kalau anak-anak bisa memakainya, pakai masker sebaiknya dipakai, karena masker ini penting untuk mencegah transmisi dari orang yang sakit ke orang lain, ataupun sebaliknya untuk terpapar dari droplets dari air liur atau bersin-bersin orang-orang yang terkena COVID. Jadi masker tetap penting. Tapi untuk anak-anak kecil yang usianya di bawah balita atau bayi, masker ini juga punya potensi bahaya karena bisa menyebabkan choking atau tercekek ya dengan talinya. Jadi di setting seperti ini sebaiknya kita pakai hal-hal lain yang lebih common sense untuk mencegah COVID, yaitu dengan hand sanitizer, dengan vaccinating orang-orang yang di sekitarnya atau masker di orang-orang sekitarnya. Jadi untuk jawaban tadi ya yang di shopping center atau di park, kalau mereka tidak bisa memakai masker, maka kita usahakan social distancing, kita usahakan orang dewasa yang pakai masker, dan hal-hal yang lain. Okay, I think we can continue. It's 3 o'clock now, Zaki.
Oh, yes. Oh my God.
Yes,
time
really flies. We really enjoy the discussions. We have some more questions here, but I think we might just stop for a minute and enjoy some performance that has been prepared.
Fantastic. And then inshallah, after the short interim, we will continue with the second part of the discussion, which will focus more on the psychological and the, I guess, the social aspects of COVID-19. So operator, if you could share the performance by our very talented girl, Miss Rina.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nisrina Hassan and I am in grade 2. I am 8 years old and today
Is it possible to increase the volume?
called Step by Step by Ross Guthrie. Step by step to a new sunny day. Step by step, just take it slow. Step by step, it's no longer gray. Step by step to a new tomorrow. Come outside to applaud tonight. Clap throughout the nation. Everything will be alright, no matter the location. Step by step through small puddles. Step by step through them all. Step by step, splash away the troubles. Step by step, no matter how small. Keep your hopes up high, even if spirits seem low. We will get by, so let all feelings show. Step by step, we'll make it through. Step by step together. Step by step under a sky so blue. Step by step forever.
Subhanallah. That's it. We'll get through this step by step.
Sure, very positive. Thank you, Nisrina Hassan. MashaAllah. Allahumma barik. Now, Zaki, would you like to go to the next questions for our second discussion?
Okay, so just wanted to remind everybody that they can post their question in on Slido, which a lot of people have been doing. But inshallah, with the previous questions in regards to, I guess, the medical aspects of this discussion, what we will do, inshallah. We will ask Dr. Rubina afterwards that if she does have the time to maybe answer like a few of these questions, of course, on her own time, definitely without any pressure. You know, maybe if some questions are very pertinent and maybe very helpful for the greater community, if she does have time, we'll save it for then. But inshallah, now we will be focusing on the I guess psychological and the mental health aspect. I guess which is really important too. I guess when Dr. Rubina did point out that COVID isn't really just about, I guess, the physical symptoms. However, it's the thing that you are missing while you're, under the effects of COVID, such as the learning, such as, not being able to work or think straight. Inshallah, these are some of the things that we'll be focusing on this discussion phase. So inshallah, with the first question, Dr. Rubina. So I guess, how has COVID, like from your observations, how has it affected children mentally, more so than physically?
I think, yes, I think the first thing is that, like you pointed out, the COVID has affected everybody. So the children are affected by what's happening to the family. The family's gone through a difficult time during this lockdowns. If they've had infections, for instance, I think we'd had parents who had been admitted with severe COVID, and those kids have been may have had mild symptoms. Like we said, children have not had severe, but seeing your parent being admitted to intensive care or being admitted to hospital, that's a big effect on a child, not just then, but for a very long time. That could have a very sort of a profound effect on the child, and especially for very young children who are very difficult to. So we'd had some children who we'd had to admit to hospital. They were called. They are still being called. They're still being admitted, not themselves with COVID, but they're put in different wards, and they call them the COVID orphans sometimes, because they just don't have any parents to look after. So they're being looked after by the nurses and other people in the hospital. So I think that's an effect that we've seen, especially when it was on the rise and people were not vaccinated and were being admitted to hospital. But in day-to-day, we'd had other issues with delayed presentation with other illnesses. So, the parents have just been so scared to bring children to the medical attention, to the pediatricians or to the GP, and the GP is unable to do face-to-face consults. And they're just scared to go to the hospital in case they catch COVID, that they've not come to the hospital to our attention, and sometimes those are delayed, like a tummy pain, who might have an appendicitis, or children who had missed their immunization. So that we had seen during this time that, or developmental sort of what we provide children with, supports with an occupational therapist, a speech therapist. All those things have been delayed quite a bit because of not coming on time and a scare. But in children themselves, we'd also had seen increase in behavioral disorders. So I get a lot of patients are being referred at the moment with their children with having behavior issues. There had been a significant increase in screen time because parents, are unable to provide them with other activities, not even able to go, but also this online learning, which has its own negative effects in terms of the increase in screen time. I think we've definitely seen more increase in these people who have less, who are already disadvantaged and less supported families. So I think, to summarize, I think it's been a delayed presentation of other illnesses. There's been increase in behavior issues, and there's been increase in screen time. Those are the sort of things that we've been seeing more of because of the lockdowns, and then the psychological aspects of your own. I think your own family being affected, and the people have been affected by things. People have lost their grandparents or other people's the family's friends' grandparents, and being affected by that.
Yes, there is some question about anxiety as well in the polls. Dr. Rubina, I might touch on that, but before that, let me just summarize for the native Indonesian speaker here. Ibu-ibu, bapak-bapak, tadi poin yang disampaikan sangat penting ya. Ternyata dampak COVID kepada anak-anak ini sangat bermacam-macam. Yang pertama yang disebut COVID orphan atau anak yatim karena COVID. Orang tuanya kena penyakit yang parah dan harus masuk rumah sakit, tidak bisa menjaga anak, maka anak-anaknya harus masuk rumah sakit untuk dijaga sementara oleh para pekerja kesehatan. Yang kedua adalah isu dari behavioral issues, dan juga karena banyaknya screen time ya, subhanallah. Alright, so with the anxiety, Dr. Rubina, it's the anxiety about the pandemic itself, isn't it? There's a question over here about social anxiety. So after prolonged lockdown of not seeing massive people around you, you feel some sort of anxiety in going back to the community. And now we have more freedom and people go back to sort of more normal life. Some children have this social anxiety after a prolonged lockdown. What would be your tips to help aid these transitions?
Oh, I need this. And I guess like to simplify the question, because I actually, one of my friends made it quite a nice phrase, a nice question. It's like how to make friends after lockdown.
Oh, that's true. Very, very true.
I think the first thing is, alhamdulillah, I think we have to say, I think children always see how adults behave. And I think they don't need to be told how to do things. They just copy how, so families who are more stressed and who are more anxious, their children are always more stressed and anxious. And I think and it is difficult. And I think it is why it is important. And when I talk to parents about management of anxiety, I think it's the management of anxiety, first of all, the management of anxiety in the parents and within the adults around and the teachers around. I think if you take the situation as I think one of the things that helped me or things is that, I think we do as Muslims, for instance, we remember to do your azkar always. I think your protection is going to come from Allah subhanahu wa ta'ala, and so you do your morning and evening azkar, and remember that it is, your angels are there always to protect you, whether it's a social anxiety, whether it's anxiety about getting the virus, as well as anxiety about your own health. It is, I think we need to really put it in perspective that this is, I think it's, people get anxious because they think, what is going to happen? How do I do it? I think you just do it the way that, you just need to be yourself. And I think your help is, there is a lot of help with you. Your spiritual help is with you anyway. But I think the parents and the people around manage the situation for the child. And I think if we keep, almost like if you talk about anxiety too much to a child, they get more anxious. I think it is, and I tend to not use words around anxiety, depression, and things like that. These things exist and they are there, but I think that it is important to also manage. It is good to be anxious. It is good to be anxious to be able to get, because if you're not anxious, then you're not worried about anything. You don't want to be on the other side. You need to be anxious about your exam. You need to be anxious about, but as you already seen in that video and some of the videos, the children are just so excited to be just back at school. And none of the children have said, and then most kids, even the children that I treat for anxiety a lot, even those children are saying, we just want to be out with our friends. Even if they have one friend, they just want to be out and they want to be, and it is, we don't, I think we're also still saying that, it's only 10 people allowed in the house. There's a reason for only 10 people allowed in the house, for us to really get used to getting people back in our homes, rather than having 100 people in our, just having big parties, because we are just not ready for it. We need to, just not from just the virus point of view, but also just from our mental, what do you talk about when you talk to people now? Because we have not talked to people other than and other than pandemic. There's nothing else to talk about in our lives for a very long time. And people have no talk about fashion because they're all in their pajamas all the time. So
that's right.
I think that there would be. So I'm not sure that, I think there's a sort of big tip. As I say, I'll just say, look, I think it will pass. We just have to, we take each day as it comes, and you have to be very, very positive about it. I think try everything which is positive in your life to keep it positive. What if your child will get virus? I think, don't blame them. What if the child is going to get ill with it? I think if they are ill with it, we were going to support. It's just like if we support everybody else with an illness. I think your parents are going to support you. But social anxiety, I think children who already have social anxiety, even those children are very, very keen to go back to school. The children who are not keen to go back, and I have to just, and then I'm really harsh on parents. Sometimes I just say, maybe there's too much nice things happening in the house. So if you're giving them free time on the screen, that has to be completely zero now. So there'll be no screen time. If you're letting them be awake late at night, that routine, because, it's very exciting for everybody to be up till 11, 12 o'clock, because that was also happening during the pandemic. So not having that routine. So we need to go back into routine. So I think routine is important for children to manage that anxiety, to get back into to managing that thing. And like I said, trying to make home as a nice place, but home is not school. Because if we are not going back to school and you're very anxious, then there is that needs to be addressed. Sometimes it needs to be addressed by your GP or but somebody more specialized in dealing with it if parents are finding very difficult for a child to get back.
Thank you very much. It's actually very, very comprehensive. Let me just translate that a little bit. Beberapa poin yang penting ya ini semua. Yang pertama, monkey see, monkey do, as they say. Anak-anak itu akan meniru orang-orang tuanya, orang di sekitarnya. Jadi jangan panik, tenang, breathe. Everything will be okay. Tenang saja. Nanti anak-anak akan dengan sendirinya menangkap psikologi dari orang tuanya dan mulai relax juga. Orang tua yang anxious, maka anak anxious. Orang tua tenang, anak pun akan tenang. Positif ya. Dan alhamdulillah sebagai muslim kita punya zikir pagi dan petang. Mari kita undang keberkahan dari Allah dan juga malaikat-malaikat penjaga ini dengan terus menjaga ya zikir kita pagi-pagi, malam hari, zikir Quran, zikir sepanjang hari, dan semua doa-doa yang diajarkan oleh Rasulullah SAW. Yang ketiga ini adalah dengan rutinitas yang sehat. Jadi anak-anak yang sudah kebiasaan di rumah dengan tidur malam hari atau kebanyakan waktu menonton TV, screen time, sekarang waktunya kita kembali disiplin, tidur sebelum mungkin jam 8, jam 9 atau setelah Isya sekarang, dan pagi-pagi bangun pagi sesuai dengan waktunya dan jangan terlalu banyak nonton TV. Alright, I think I have summarized those important points. We might move on. There's a questions here about further support to mental health. So if the children actually have mental health issue that needs medical attention, apart from GP, do you have any suggestion for additional services?
I think before we get to the services part, I think how can parents identify, because like of course, like before you bring them to a GP or you bring them to a psychiatrist or a psychologist, you need to, as you said, like have that worry, be able to identify the issue in the first place. So at least from my experience and previous talks from, I guess, like the teenager side, we've finally been open about, like, I guess, the mental challenges. But then I guess with children, because they aren't very, I guess, good with their words, maybe not very, connected with how they feel and can't really express, how can parents identify these in their own children, these like mental challenges and mental issues?
So is this a question for me or for Erica?
For you, like how can parents?
Okay. So I think yes, it's. I think the first thing is the identification, and then maybe then providing the support, and then and labeling perhaps after that, and then saying some seeking help as well while we're trying to provide support. So that the number of things that if they, like you said, that they don't articulate it very well, some especially young, very young children, it's difficult to for parents to know what's happening. And I think it may present as behavioral issues, so that they're getting just angry over things that they've never, sort of they've not been angry before, having tantrums. So, you heard about 2-year-old tantrums, but there's they're 3-year-old, 4-year-old, 5-year-old, and they're having tantrums, unreasonable tantrums. Again, and the big one is a sleep issue. So I think a lot of children would have difficulty getting to sleep, staying asleep. Those are the main two things. They're awake in the night, they're getting to bed too late, or they're just finding it very difficult to wind down. So that's one big thing that I find, the sleep issues. The school refusal is another thing that, that could be due to an underlying anxiety. Your child may have started, especially slightly older kids, they just provide what we call as somatic symptoms, like throwing up or refusing to eat, or poor eating. They're eating, but they're eating small and they're not eating right food. And some of them would have intense fears, just fears about coming out of the house, coming out of their rooms, fears of the virus itself. So that's so that's how you recognize that this is a little bit more than what just a normal talk between you and your little one. An academic decline. I think that's the other thing. Your child has been doing okay, but then suddenly you find that they are not concentrating. They are not, they're not achieving. So I think those are the things. So the sleep behavior, changes in the behavior, eating, and in their sort of play and in their academic decline, difference in that. That's how you pick up. And if that persists over a period of time, so okay, we can have again, I think I would go back to how the mental health of the adults around them as well. So I think that's a big thing with children, that obviously we want to know what is the mental health of a parent is. If they are very worried, and they would be worried about different things, with adults have a lot of reason to be worried, then a child will be worried, will manifest its worry maybe in just a disruptive behavior, because and not because they are being disrespectful, but they just don't understand, they're just confused, and that's the only way they are getting the attention. So they're like an attention seeking behavior.
Yeah, very important there. Excuse me for a moment while I translate that. Bapak-bapak, ibu-ibu, mengenali masalah kejiwaan pada anak. Ini hal yang paling penting ya. Bagaimana kita tahu bahwa hal ini memerlukan penanganan yang lebih serius. Yang pertama, jika behavioral issues, ada sikap yang tidak biasa, tantrum, rasa takut yang berlebihan, hal-hal yang memang bukan biasa sikap anak ini. Kemudian tidur itu masalah yang penting. Jika anak-anak mulai terlihat ada masalah dengan tidurnya, tidak bisa tidur, atau tidur terlalu lama, bisa menjadi tanda-tanda awal dari masalah kejiwaan pada anak. Lalu sekolah pun hal yang penting. Kalau tiba-tiba anak tidak mau ke sekolah atau performance akademinya mulai turun, maka ini menjadi red light yang lain ya. Terus nafsu makannya, dan juga psychosomatic symptoms, jadi gejala-gejala dalam tubuh yang sebenarnya bukan karena masalah penyakit medis, tapi karena kejiwaannya. Poin terakhir sebelum saya kembali ke Dr. Rubina, yaitu adalah kondisi kejiwaan dalam keluarga. Alright, I think we've done with that. Now, look, so the next question is one we've already recognized. There's probably some of the mental health issue that we need to look after in the house. If we do notice serious symptoms and we are concerned, what are the additional services that we can go to in the community or maybe in the hospital?
I think the first is usually the child's GP or your own GP to talk to them and explain why and what you're experiencing. I think that's very important because your GP would know your family background and would know the child itself, the child's medical history as well. So know that this is, so I think it's, like I said, that we've had a number of referrals now from GP, for instance, coming up and asking for help to pediatricians. But I think that the important thing to remember from the GP point of view is, and from the parent point of view is, I think that people are worrying that these things are something that the child may have a developmental problem, and that's why they are not coping. I think that's important to differentiate. Is this due to a situation which has happened, or is it something the child has always been? There is some issues that they have been finding difficult. They've always been an anxious person, and they've always had this social problem. They've always had some issues with the academics and things like that. Those things. Or is it something new? I think that those types of things, these need to be differentiated, and the GP is a good place to start that. And once the support is there, after that is usually GP's decisions to decide whether they need to go and find a counselor. And there's a counseling at schools. There's usually counselors at school which provide support. Talking to the teachers, I think keeping it, and the first thing is talking to your child yourself. I think it is very important to make time for your child, and have and be honest with them. So I think you need to listen to them without judging, and stay calm and positive, and try to make sure that you're trying to be helpful rather than get so worried about it that the child finds that, how do I get a support? Because they might get more withdrawn and more into their own, maybe, sort of like the online activities and things like that, because they're getting support from the wrong source or something themselves. So there are lots of supports available but it is always good to get the support through the parent first, rather than the child trying to manage it themselves, and then to the GP. And if the GP decides that they need to go see a counselor or a psychologist or a pediatrician, then that will be the next step. And after that, I think psychiatrist usually comes right at the end. So I was a little bit horrified when you said send them to the psychiatrist, because the psychiatrists are good. There might be a psychiatrist in the audience, but I think they are they're good. But I think I don't think we need to send them straight to the psychiatrist to medicate and do things. I think they really have lots of other resources we need to use first. Children's, it's the Raising Children Network. That's a very good resource that they for younger children and for teenage that we often use.
Yes, parents first, isn't it? Parents first, mashallah.
Parents first, and I think it's important to really sort of try to differentiate. Is it the parent's problem, or is it actually the child problem? I think sometimes it gets very confusing for a parent, because they're putting their own worries, what is, rather than listening to the child, what actually is a problem. I think so. I think that's important to sit down and be honest with the child. Tell them what the answer is. So if they're worried about the infection, tell them the right thing about it. So rather than getting information from their friends or getting it from the media, because I think you need to be honest with your you know, and I think when, like I said, this, I try not to use the terms very loosely about these things with the kids. You know, if the kids are being told, he's depressed, you know, when we consult with parents about children's anxiety, depression, behavioral problems, it's usually get the child out of the room to talk to parents first, because it's important that we don't give a name until and unless we, you know, because once the child starts to say, I have it, and then they find a lot of misinformation, as it happens with the vaccine and a lot of things, they tend to not get better because they know, but that site says, I have to have this medication before I get better. You know, it's the misinformation is that there's a lot of misinformation. So I think it is important that the channels are kept open and honest, and we kept, you know, to the right people, to, you know, like the GPs to explain, or to the counselor to explain, or to our parents themselves to explain what is happening.
Yes, very good. I would like to translate that for a moment, Dr. Rubina. Jadi, Bapak-bapak, Ibu-ibu, jika kita khawatir ada masalah mental health dengan anak-anak, maka yang pertama adalah kembali lagi koneksi orang tua dan anak. Kita lihat dengan jelas sebenarnya masalahnya ada di mana. Komunikasi kembali antara ibu dan ayah dan ibu dengan anak-anaknya. Lalu kemudian yang pertama, setelah itu clear, bicara pada GP, atau kalau masalahnya di sekolah ada guru-guru dan juga ada namanya counselor yang ada di sekolah ya. Kemudian ada website Raising Children Network yang juga sangat bermanfaat, yang bisa kita cari informasinya di sana. Last question, I'm aware of the time, Dr. Rubina, I think you need to go somewhere. Last question about special needs children. So children with special needs, will there be anything else that you can add to the parents in supporting them?
I think it's been, it's fair to say it's been, you know, it's harder for the parents of children with special needs during this pandemic, and especially when the lockdown had been, you know, so severe that they couldn't go to schools at all. But it had been, you know, I think time to time when they had the exemption that they've been able to attend, that had been a bit, it's been good, because I think one of the things that is important for the children with special needs, all children need routine, but these kids with special needs, they need more routine. They're so used to it, and they do get very worried, and they do get because they don't understand why the routine of, you know, that is not happening. So it is harder, and it's parents require lots of patience, and you know, I take my hat out to them, because they, you know, it's a day and night that they require patience with. And but for a child, I think again, you need patience, but you need to praise them a lot. I think you do need to reward them, and sometimes you need to reward them extra when things are not as normal as it. You know, it could be that if they have to isolate and they don't understand, I think you need to make more time for them. Because almost like what it says, that you just have to go down onto the weekend routine that you normally do with your child, that you have to do that weekend routine for a bit longer rather than just Saturday, Sunday. You have to almost follow that weekend routine with the child with special needs. Visual stories are very important. So some visual stories is like a sort of drawing, and there are lots of some of the visual stories that you can use, the animation and things like that, for them to look at it, and then, you know, it's teaching the things about hand washing or social distancing or wearing the mask. So using those visual things we normally use for children, but children with special needs, again, they do tend to learn a bit more from that. And making, I think some of these children do have other services like an occupational therapist and counselors and psychologists to help through this pandemic, especially that making more use of them now that we're back to face-to-face. Wearing masks, I think these kids may need a letter of exemption. And I think make sure that they you do get a letter of exemption from your GP or from the care providers, because they are exempted from wearing masks.
Yes, thank you very much, Allah.
I think, and their anxiety might get worse because, I'm just taking an example of children with autism, for instance. They're non-verbal, and some of them, they can't talk, they can't communicate properly, but they may, they do have associated anxiety or low attention, and that need to be managed a little bit more carefully during this time. And most of them are connected to a pediatrician or a GP or services. I think just sort of making sure that you are keeping in touch with those services. That's important, that rather than you just struggling that, on your own.
Yes, subhanallah. Thank you for your comment, Dr. Rubina. Ibu-ibu, bapak-bapak yang memiliki anak dengan berkebutuhan khusus, subhanallah, semoga Allah memberkahi ya para orang tuanya dengan ujian ini, dengan pandemi ini. Perlu banyak kesabaran memang. Yang pertama tadi, jika perlu menangani, misalnya perlu isolasi selama beberapa waktu dalam rumah, beri anak reward, dan juga banyak dipuji ya untuk mengikuti social distancing, harus pakai masker atau harus isolasi di rumah gitu, hal-hal yang mungkin harus dilakukan karena masalah pandemi. Dan juga informasi bisa diberikan lewat visual story, biasanya lebih mudah untuk menangkapnya dengan ada visual cues. Kemudian semua resources yang sudah dimiliki karena memiliki akses kepada pediatricians, occupational therapist, atau juga psychologist, gunakan kesempatan yang ada untuk tetap connected dan reach out kalau perlu bantuan dari medical services. Well, thank you very much, Dr. Rubina. It's our pleasure. I don't think the time will be enough to talk about all of this. We will really, really appreciate for being here and sharing your knowledge and expertise to us. It's been a great pleasure. It's 3:37, and I know you said to me you have to get somewhere else as well very soon after this. I really appreciate. After this, we'll go into the comments.
No, I'm here, and I'm happy to stay till the end. And I think if there are other questions that parents want to, I think we have to say that we didn't give that much chance. We've been talking too much, so we need to be quiet now and let the audience give a bit of a chance to any questions.
All right, then, if that's the case, I might ask permission to ask one more question. There is something that we haven't covered here about rapid antigen tests. Should we rely on the rapid antigen test when having a child with symptoms and deciding to send them to school? Maybe that will be our last question to you, Dr. Rubina.
No, I think it's a very important question, and I think this is going to be, like we said, that it's going to be happening more and more in our schools, and we've already seen people need to be isolated. So I think I'm not sure whether the audience is aware of what the current Department of Health recommendations are. So I think if your child comes, I think that I'm just going to go through that very quickly in case people are not aware of it, but I'm sure schools are keeping up to date with it, with the parent. But if your child is in contact with a confirmed case and come home, they have to have a test done, and if they are negative or positive, but if they're tier 1, they have to stay for 14 days in ISO. But you as a parent don't have to go into isolation or do have to do the quarantine. I think you only have to do it if your child is positive, and then you have to, then you become obviously the close contact, and then you have to be isolating yourself for 14 days. If you're double vaccinated and you're negative and your child is positive, you only isolate for 7 days, and given that you're negative for the test. So lateral flow, or this rapid antigen testing, that has just become available in Victoria from this week. It's just going to be very useful, because if you are negative, you can rely on it, but you have to confirm. I think if you're, and this is going to evolve as we're going to keep, seeing more cases, but likely that if you are, it is, if you're positive on it, you have to confirm it with a positive PCR. So you have to use that as a first line. So if you're negative, you might still be able to go back to school next day.
Okay. So if you're negative, you can rely on it, but if you are positive, please confirm with PCR.
Yes.
Yeah. I want just highlight rapid antigen test berbeda dengan PCR. Ya, jadi PCR itu yang di testing center yang kita biasa lakukan saat ini, tapi rapid antigen test ini adalah tes yang bisa dibeli di chemist dan dibawa ke rumah. Jika hasilnya tidak se-reliable PCR, jadi kalau hasilnya negatif, kemungkinan besar itu benar dan kita bisa melakukan aktivitas seperti biasa. Tapi jika positif, jangan panik dulu, confirm dengan PCR, lalu lakukan sesuai dengan hasil PCR tersebut. Alright, thank you very much, Dr. Rubina.
You're welcome.
Inshallah. I think the next thing on the agenda is the games. Inshallah. So I guess so these are games and quizzes in regards to the topics mentioned today, and I guess some of the questions will be adhering to like what was said by yourself, Dr. Rubina, and also I guess general questions regarding the organization and also the general information in regards to COVID-19. So I guess I think in terms of the discussion phase, this is the all the time that we have left. Inshallah, if there's any questions later, we'll have to facilitate that some other way. So I want to begin by thank you so much for your time and your effort. Alhamdulillah, I feel like a lot of the questions here are very useful, very helpful, and I guess a lot of it deals with a lot of the stigmas around, I guess, mental health. And inshallah, with with your expertise and with I guess your comfort in us, inshallah, it'll make us, I guess, better parents and better members of the community, make us stronger, make us more knowledgeable. I welcome you to stay around if you'd like to, perhaps I don't know if you can join the games. Maybe you'll be answering it very easily, and it might be a bit skewed, just because you might be too knowledgeable on the facts and might not be
overqualified.
Yeah, overqualified. And everything.
And that's the fun part. That's the best part of it. So I'm going to stick around. I'm not going to answer, but I'm going to stick around to see what our kids are playing.
Awesome, fantastic. So, inshallah, Dr. Eka, would you like to explain would you introduce the first game?
Oh, sorry. Yeah, it will be from Kahoot, isn't it? Could our operator help to get the
link
ready?
In the group chat, please?
Okay. So we know about Kahoot. Waiting for the players to come in.
By the way, when Do we know what the prices are? Erika?
Yes, we do.
Yes, we do. But beforehand, are we echoing?
Yes.
Test. Still echoing.
Maybe is it possible to be operator? As in just mute that microphone. Maybe that'll help. Is there still an echo? A little bit.
Participants. Monstera. Must be someone who like indoor plant.
I think we'll wait 1 more minute for the systems to right. Allow us and I'll start. So it will be everyone, right? Everyone, right? Not just the kids.
Yes, this is for everyone. Adults and kids, please join. In the meantime, we might try to fix the echo. Testing. Echo.
Alright then. So, oh wait, the echo's gone.
Echo's gone. Goodbye, Echo.
Fantastic. This is awesome. Alright then. So, should we make a start now?
Yes, we can.
Alright, let's count down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's go. starting? A little bit of technical difficulties. Maybe they're in the toilet. That's all right. We'll wait a little bit.
Yes, you can start, please.
Start.
Oh, hang on.
Oh, okay.
There are more participants now. There are more people coming in.
Inshallah. Let's we're gonna be quick. We are almost reaching 4 p.m. So peserta means contestant, right?
Contestant, yes.
Contestant, participant. Yeah, you guys gotta teach me bahasa Indo so that I can when you guys ask me to come and do speaker, I feel like, oh, my Indo's not up there yet.
We'll give you Indo lesson course. Maybe that's the next Madania Foundation need to have Indonesian.
Oh yeah. I'll be
just for you, Zaki.
Just for me. I'll be asking Kang Rian, Okay. Where's the course? There's a Quran course. There's a
Quran course, Indonesian course.
There's an English course. Where's the Indo course? The loser. Had a name in that. Let's go. Respect constitution. Respect confidence. Don't leave yourself to the always potential winner or winner in the future.
Oh, we got I win and the loser.
Is it possible to reduce the music volume just a little bit? Because I feel like it's a bit overpowering. The speakers.
That's perfect.
Perfect. Awesome. So let's get a start before it's a bit too late. Awesome. Let's go. All right. I'm joining too. I don't know. I haven't seen the questions, so I think it's fair.
You love other things that people do more.
Bring lockdown, except. What? There's no way people exercise at home. It's boring.
Oh, you guys been doing the right thing.
Inshallah. Hey, but what if you're in a student household? You'll be sharing food with non-family members, right?
Oh, that's quite true. That could be your family-ish for the day. Monstera leave the games, mashallah.
Technicality.
Let's go
All right, next.
These are the things people chase to do straight after lockdown, except. So what is it that you really want to do after lockdown? Pampering yourself, hanging out with friends, browsing inside the shop, or watching TV at home?
Pampering? Oh, what do you mean by pampering?
Oh, maybe going to beauty shop?
Oh.
Getting your nail done? maybe, or pampering yourself and going to cake shop and have a lot of sugars in there. Monstera still leading the game, mashallah, followed by Hamka and KZ.
Subhanallah. Monstera, actually a monster. So number 3, things that are supposed to be familiar for people to prepare lockdown easing, except I can't even. Okay, I didn't even get to read the answer. But yeah.
Too quick, isn't it? But people are good. Alhamdulillah. Very good, very good.
Oh, Monstera.
Monstera still leading the game.
Hamka on a streak. So let's go. Looks like it'll be quite close with the top 3. Maybe too late for me. What are the things that children and parents can do to prevent catching COVID? Oh, maybe green isn't the thing, right? Because Dr. Rubina just said, you know.
Oh, I tried to mislead. Didn't happen.
That's it. Oh, KZ overtaking Hamka. The Monster are still at the top. Fantastic.
Very, very good.
True or false? COVID-19, hay fever, and common cold can have almost the same symptoms. Oh, I know that.
True. Is it false? There's no maybe. There's no maybe.
No maybe.
True. Yes, they do have similar symptoms, don't they? Bebaslah going. 5 correct answers are right.
Let's go. True or false? Madaniya Foundation was formed in 2011. All right. These are for the people who were paying attention. When do you think they were formed, Dr. Erika?
I do believe they was formed in 2000 and something.
Oh, that's almost a 50% split.
Yes,
you know?
2010. Actually, 2010. Just 1 year difference.
Just 1 year.
Monstera still leading the games.
It's pretty tricky question.
Long lockdown can affect children's psychological conditions. Here are some of them. Anxiety, depressed, puffing, shortness of breath, muscle and joint pain, and fever.
All of them.
Psychological condition.
Oh, psychological. Couldn't muscle, muscle also be
psychosomatic symptoms?
Yeah, psychosomatic. That's it.
Whoa.
Muscle overtaking Monstera. That's it.
We've got 3 more chance. Question number 8. Madaniya Foundation build up the contribution within communities through Al-Quran, leadership and skill development, family and youth da'wah, or all of the above.
All of the above.
All of the above.
I would have said through friends, and because Kang Rian's pretty down to earth and friendly guy, so I was indoctrinated by him. All right. COVID-19 vaccination can be given as early as for those that 10 years older or 10 years old ages or more. Is it true or false? I know this one.
You know this one?
Yeah, that's
Good
it. It's
job.
false. It was 12, right?
Yes.
That's it. I know my politics. Ooh. Very
KZ
close.
and Hamka, very, very tight. Bebaslah still leading the game, followed by Monstera.
By 86. All right. I believe this is the last question, right?
Yay.
Number
True or
10.
false?
There will be isolation every now and then within places, even though there are no more state lockdowns. Oh, isn't this a bit controversial?
Local isolation is what they call it, I think.
Maybe. Ooh.
True. Yes, if there's cases in your local area, like your school, then the school students have to isolate.
Hamka coming in number 3. Monstera coming in number 2. And our first place winner is Bebaslah. Maybe.
Well done, everyone. We got runner-up as well. So, Zaki, what are the prizes? Do you know?
I actually have no idea.
I think I got a clue here. So, the first winner of podcast of Kahoot quiz in podcast today will have $30 vouchers from Madania Foundations, and the one on the second place get $20, and third place $10. Congratulations, guys! So, Bebasla, Monstera, and Hamka, would you please contact our host here? So we could then give out the vouchers. Well done, everyone. Mashallah. Mashallah. I hope everyone enjoyed the game. Do you enjoy that too, Zaki?
Well, I think I came in last, or maybe second last.
You lost, Jackie?
It's scripted. I blame you, Kang Rian. It's not fair.
Okay. Scripted to be lost.
Scripted to be a loss.
Okay.
All right. We still have 2 more door prize. We have 2 more door prize. So for the best questions and the best comments.
Ooh, is this also gonna be a voucher from Madania?
Yes,
sorry?
Yes. So Madania
Oh,
Foundation, supported by and sponsored by Human Initiatives, will have $10 voucher for the best questions and another $10 voucher for the best comments. Shall we reveal? So the first best question is, what would be your tips to help our children who tend to have social anxiety after the prolonged lockdown?
Fantastic. Remember, please to give your details to the host, and inshallah they will get more of your details to send you the prizes, or big vouchers by very generous leader Kang Rian.
So send your details to Madania Foundation. That's our host today, our IT guy on the background. And for the last door prize, will be for the best comment. I'll read it out. Would you like to read it out?
Or maybe I'll read this one out. So inshallah, for the best comment, it's quite a long one. Inshallah,
Does Indonesian too?
I'll do my best. Right. So the best comment comes from Anonymous, that it says, Alhamdulillah, selama ini belum banyak informasi mengenai COVID terhadap anak, hanya sekedar informasi yang general. Di acara ini banyak informasi yang saya dapat, terutama pentingnya orang tua menyadari psikologi anak terhadap perubahan lingkungan dalam kondisi seperti ini. Oh, that felt fluent.
Oh, that's not bad. That's not bad, Zaki.
Very good, Zaki.
What do you think, Amrian? Do you think you'll pass the Indonesian
Indonesia Bahasa Indonesia exam? Yeah.
Maybe just for the pronunciation part, I didn't understand it at all. So comprehension. But inshallah, the owner of this comment, please give your details to our host, and inshallah you'll be getting a big prize from.
Also, if not, can be also sending to our email, madania.foundation@gmail.com anytime.
Madania@gmail.com.
Yeah, Madania. I'll type in it. Madania.foundation@gmail.com. That's our email. So the winner or the every winners also can be sent to there.
Somebody has to translate that comment for me.
Oh, okay. Dr. Erika is the best.
Oh, okay.
You did very well, Zaki. That was perfect Indonesian.
Oh, that was perfect. Nice.
Because I can say it was perfect.
A perfect judge. As long as it sounded fluent, right?
Yeah, it sounded good, but I had no idea what was said.
But that's Dr. Robina. This is actually a thank you to you too. He said, Alhamdulillah, there are a lot of information about COVID. Actually, no. There are not many information about COVID in children so far. It's just general information. So this person found a lot of important information through this podcast. And especially about parents to understand the psychology impact in this kind of difficult situation. And there's also a lot of comment in the chat to thank you, Dr. Rubina, for your help and your expertise and sharing of your knowledge. Very reassuring for the audience and also very informative. Alhamdulillah. May Allah reward you and make your life full of blessings, Dr. Rubina.
I mean, thank you, Dr. Rubina.
I mean, alhamdulillah, because I enjoyed every single minute of being here. So alhamdulillah for inviting, and all the best for all your projects. Inshallah, I'll say assalamu alaikum now, and inshallah keep in touch.
Inshallah.
Inshallah. Waalaikumsalam
Waalaikumsalam warahmatullahi wabarakatuh. All right, guys. I think that concludes our very nice, and was it long? It felt quite short for me. The acara for the preparing family for re-entry post-COVID-19. Inshallah, we'll end it with a short dua by is Shahri here to do the closing dua.
Inshallah, inshallah. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. My dear brothers and sisters, it's time for us to contemplate and seek protection always from God. For all this challenging time, may God give us the help in every single step we take during lockdown easing. Let us pray based on our own belief. For the Muslim, let us read the dua by saying, A'udzu billahi minasyaitonir rajim. Bismillahirrahmanirrahim. Ya Allah, Ya Arhamar Rahimin, Ya Dzal Jalali wal Ikram. Allahumma sholli ala Muhammad wa ala ali Muhammad. Allahumma la sahla ila ma ja'altahu sahla wa anta taj'alul hazna idza syi'ta sya'la. Rabbana atina min ladunka rahmah wa hayyi' lana min amrina rasyada. Oh my Lord, please give your guidance to us in every step we make in this space, lockdown easing. Please don't let us be far away from you. Always give your protection and blessing. You are the only one that make things easy, even though it's look hard in front of your servant. My Lord, bless our life with good health, wealth, obedience, and gratefulness. With all of those hardships we had during lockdown, there were also things we learned. Please make it as a part to obey you more, the journey to love you more. So as human beings, we become wiser for now and in the future. Strengthen our heart with encouragement and optimism. So the hope's still there to be better day by day. Oh my Lord, please save us in this dunya and hereafter. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Amin ya rabbal alamin. Wassalamualaikum warahmatullahi wabarakatuh. Thank you everyone and have a lovely afternoon.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Shahri, for leading the dua today. And inshallah, that conclude our podcast today. Thank you very much, all the audience, for coming. And hopefully it has been beneficial for everyone. And again, thanking our sponsor, Human Initiative, who supported our event today.
And yeah, that's it, I guess. Thanks for everyone for coming. Hope you have a lovely day.
Erika, for organizing.
Thank you.